Hi, my name is Jordan Heights and I'm a student physical therapist assistant, and today we're going to be going over how to measure and dress a venous stasis ulcer. Venous stasis ulcers are primarily caused by poor blood circulation in your veins. So whenever your veins are not able to pump blood back up to your heart, it sort of pools kind of in your lower extremities, and it can lead to something called venous hypertension. Some telltale signs of venous stasis ulcers are hemosiderin staining, which is kind of that brown, rust-colored discoloration of the skin caused by that interstitial fluid leaking out and the red blood cells dying. Venous stasis ulcers typically occur on the medial malleolus or kind of the lower extremity over there. But before we begin, make sure to always wash your hands with warm water and soap, and then have your PPE, so gloves, a gown. I would be wearing a mask, but I'm making this video. And then next, we'll go ahead and pretend that the wound is nice and clean. We cleaned it with clean, sterile water, used a 15 psi syringe to kind of get rid of that debris and that slough and kind of make sure it's nice and clean. So first off, we'll go ahead and we'll measure the wound. You're going to measure it with a couple of things. Right now I have the Q-tip and then this nice little measuring chart. You can measure it with a tape measure or anything that you can really lengthen it with. So you measure with length, width, and depth. So length is from top to bottom. And this is a pretty nice circular wound. Alrighty, and then I'll hold that up to you so you can see it. It's probably about, I'd say 4 centimeters. Can you see that? Yeah. So 4 centimeters is going to be the length, and then the width is across. Say find the widest part across. You can see that. I would give that about 2. So the length is 4 centimeters, the width is 2 centimeters, and our depth, we don't really have the depth. We'll go with 0.1 centimeters. If you do need to measure the depth, use a Q-tip and just kind of measure it down into that wound bed and then until it's flush with the skin. There's no signs of undermining or tunneling. The wound actually looks really nice. It's 100% granulation, red granulation tissue. No signs of necrotic tissue. The peri-wound is healthy looking. There's no erythema or maceration around that. So overall, it's looking really well. However, we do have quite a bit of exudate, which is common with venous stasis ulcers. So to combat that, I'm going to use a alginate dressing. Alginates are really good for absorbing that excess exudate, and it helps kind of keep the wound bed nice and moist to promote wound healing. Then I'll use another dressing over that. So this is the primary dressing. It goes directly on the wound. Then I'll use another dressing to wrap that up to kind of hold this in place. And then I'll finish off with an ace bandage or just a more protective wrapping. So I'll do that next. A couple of key points to point out is anything that does touch the wound or the exudate or anything that you would put in the biological hazard bag, so that red bag. So I'll do this first. So I have my one dressing nice and ready. Put that on here. A good thing to note is to make sure to keep, you can put your leg down if you want, or whatever's comfortable, is if your patient is ambulatory, is to put their ankle in more of a dorsiflexed position. That way they're able to still walk. And you also don't have to cover up the toes if they're going to be walking. But you hold that on there. And then we'll go in a figure 8 pattern. So I'll wrap it around the foot twice. You want to make sure it's decently tight to hold the dressing in, but not too tight. And then we'll go into that figure 8 pattern. So you go around and then you'll wrap up around the ankle. Then you'll come back down, wrap around the foot, go back up, wrap around the ankle. One more time. And this actually has a really nice Velcro strap that you can strap onto it. There you go. And then we'll top it off with an ace bandage to kind of help protect it and keep everything in check. So again, you can start off with middle of the foot, wrap it around once or twice, and then do that figure 8 pattern again. A couple of things to make sure on is to do a sensation test with your patient. That way the bandage isn't too tight, because if it's too tight, it can cut off circulation, and that would be really bad. And it's not fun. You can make sure that you have about 1 to 2 fingers. Let's go ahead and I'll tuck that in there right now. Tuck that in there. So you can check a couple, 1 to 2 fingers, make sure that there's enough room. You can do a blanch test, so that's where you pinch the toe, it turns white, and then you see how long it takes to get back to its color. Make sure they have great circulation. You don't want it to be too bulky, so they can't put their shoe in there. And then another thing you can do, it's called an ABI, which is an ankle brachial index. And that takes the blood pressure from your brachial artery in your arm to the dorsalis pedis artery in your foot. And you divide those two, and if you have like between a 1 and 1.2, that's great, and you have plenty of circulation. And you're a good candidate for compression stockings, which are great for people who suffer from venous stasis ulcers or venous insufficiency. So compression stockings would be great to wear at work to help with that edema and help with that pain associated with that. Keeping your legs elevated when possible, kind of help getting that blood flow back to your heart. Make sure to tell your patient if they feel it's too tight or if they're uncomfortable, they can remove it. We'll probably change out the bandage every 1 to 3 days, so making sure they're not checking it every 5 minutes and keeping that wound bed nice and moist and nice and warm. But other than that, that is about it for how to dress and measure a venous stasis ulcer. Thanks for watching.